Hey, Alan here, and I'm coming to you from Wells, Nevada. This has got to be about 350 miles or 400 miles north of Las Vegas and about 3,500 feet higher. I was in another little town called Ely, spelled E-L-Y, over the last couple of days. That was at 6,500 feet and 250 miles north of Vegas. I am out of the heat. Vegas was about 110 degrees every day. Where I am is getting into the 80s and down to 60 at night or even lower. It's pretty darn comfortable. My travel goal is to head up into a really remote region north of Elko. If you take a look at a map, Elko, Nevada, and then go due north, up towards Twin Falls. There is some of the most remote terrain I think I'll ever be in, even more remote than the San Rafael Swell, which I'm still working on a post on the wedge at sunrise. You're going to absolutely flip over the video that I shot on that post. But what I want to bring to you today, this is kind of the first of a series of wrap-up posts that talk about Freedomfest and what I learned there. Now, I went there primarily as an RV'er, as a traveler, with an interest in things that I can learn relevant to the Freedomfest conference. Just to kind of fill you in, the Freedomfest conference is a libertarian conference. When you hear libertarian, think freedom, independence, and liberty. Freedom, independence, and liberty. Beyond that, the views really range across the spectrum. People to the left, people to the right. It's really an interesting and eclectic group of individuals. And again, my focus when I was at Freedomfest was to attend sessions that would be of interest to me, and conversely, I believe, of interest to you, of interest to people who are travelers, RV'ers, and frankly, the 50-plus crowd. There are a number of sessions and interviews that I did that would appeal or apply to people who are 50-plus. I'll let you decide if they appeal to them. Let me just take a quick second here, and I want to pan around. This is an interesting park that I'm in. Again, I'm just outside of Wells. I'm in a park called Welcome or something that's about 8 miles west of Wells, Nevada. They actually have a brook running right through their park. Let me kind of pan around. So those are my next door neighbors. If they look comatose, don't worry. It's after 5 o'clock and they're resting, and they're entitled to rest. They drove here in a motorhome, so hey. So some of the highlights from Freedomfest for me, and these are just a few. I'll probably be bringing up more, and I'll be zeroing in on some of them, including one in particular in this post. By the way, I'm either going to talk about in this post or in the next post what's involved in RVing in Las Vegas. There is an RV park I'm going to specifically recommend. I've learned a bit about their tax structure and about their fee structure, and it matters where you stay. So I'll tell you a bit about that. I have a feeling it's going to make the next post, but one or the other. And of course, in this video, if you go to the upper right-hand corner, you're going to find a little tab that you can click on that'll bring you over to the actual post associated with this. And I'm sure underneath me, there's going to be some flashing text or some text that'll come up saying go to rvacrossamerica.net/something. And I don't want to say what that something is until I check what the interview portion of this video is. Don't ask. Anyway, some highlights. I met Mike Lee. You're going to see a picture on the post of me and Mike Lee. He's a senator for Utah and a Supreme Court candidate on the short list. And what we talk about? We talked about Utah. I've been traveling through Utah. You've seen my other posts about Utah, and I got more coming about Utah. And I'm going to pepper in these Freedomfest and other posts alternately, probably, so that I don't sound like a giant advertisement for Freedomfest. But I do want to share with you what I learned here. The interview that I'm going to bring to you as soon as I stop yapping is from a woman named Marilyn Singleton, who is extraordinarily impressive. She's a PhD and an attorney, and she represents the AAPS. It's the American Association for physicians and surgeons. They have a website, aapsonline.org. They're not selling you anything. They have information that is relevant to you and me, because she and I talked about Medicare, some changes, and just, being a traveler and being 50 plus. So that interview will cover some of those things, including things coming down the road. Additionally, at Freedomfest, I picked up insights from John Lund, Candace Owens. Boy, is Candace Owens something. Look her up on YouTube. Penn Jillette, Glenn Beck, Grover Norquist, Mike Lee, who is also a speaker, Herman Cain. And Herman Cain is behind a new company that I'll be telling you about in another post very soon. It's a new app that could counter the silencing of voices that is occurring within Facebook and within YouTube. And you may or may not agree with those voices. I mean, one of the loudest was Alex Jones. He's a turnoff to most people, and I don't really give it much more than a grain of salt to what he says. But I'm not in favor of silencing any voices. Big proponent of the First Amendment. That's an important one. So anyway, Alan with rv'acrossamerica.net. There'll be a little bit of text under me about now, probably saying, hey, if you want to get the whole post, go over here. It'll be rv'acrossamerica.net/something, whatever that something is. But I'm going to turn you over to Marilyn Singleton. The audio is the best I could make it. It was the first interview I did. I held the camera the whole time. I used the microphone on the camera. It's not bad. It's not great. But I'm not a professional journalist, and I'm not a professional reporter. Hey, let me know what you think. All right? You can do that at the bottom of my post. You can do it on my YouTube channel. And you guys have a great day. I know I will, and I am. All right. Take care, but stay tuned. So we're here with Marilyn, and Marilyn represents the AAPS, which is the Association of American Physicians and Surgeons. And from their booth here, you can see that it's all about medical freedom. It's all about opportunities as, I guess, alternatives to Medicare. But let me turn it over to Marilyn and see what your message is and what you would particularly say to travelers that are going to be traveling from state to state. And obviously you have a home residence, but well, go ahead.
Okay, well, hi. And AAPS, has been around since 1943. And we were started because we were very fearful of single-payer health care and what it might do to all the choices that people had. And when Medicare came in, we were kind of wary of what would ultimately happen. We're seeing a lot of the things predicted that would happen, the pre-authorizations and not being able to get care that you wanted. In the traveling community, emergencies will always be taken care of. There's a bill, the EMTALA bill, that's been around forever, and it means they have to take care of you in an emergency. The problem is the follow-up, and there's all sorts of ins and outs to Medicare. Like, there's a rule, if you aren't admitted to the hospital, then they won't pay for your rehab, and a lot of people have been caught up in this. And now what they do, the hospital has to warn you of that, but that doesn't do any good. If you're the one that sat in the emergency room for 48 hours, then they never admitted you. So be very careful of that, because a lot of people have mini strokes, and so they say, oh, go to rehab for about a week. Well, you'd have to pay for all of that out of your own pocket. So that's something to be very wary of.
So the key is you want to make sure you get admitted, and then you get under a different set of rules for Medicare?
That's exactly right.
I see.
Exactly right. The other thing for free-spirited people, which a lot of RV'ers are, is a lot of people actually want to get out of Medicare, so you're not constrained by some of the government rules. And you're lucky if you haven't come across them, and then other people have had things denied because Medicare doesn't pay for it, and you have to pay for it out of your own pocket. There's a whole system and a whole subset of doctors that are opted out of Medicare where they do cash practices. And the thing that's interesting about cash practice, something that Medicare might say is a $450 charge, you can walk out of the office paying $70. because cash practice doctors don't have the same overhead. They don't have a biller. Billers, you have to pay $40,000 a year because there's 90,000 codes that have to be written in for each thing that was done to you. So there's specialty coders and all this. So that's one person you don't have to have in the office. Then they don't have to have a person that sits on the phone all day with the insurers, and that's another $35,000 in salary. So automatically that's $75,000 that doctor does not have to make. Therefore, they can charge lower prices to the patient, walk in, pay the money, walk out. And there's alternatives to Medicare. There's health share. They're called ministries. And one of the reasons is that kind of gets around some government rules. It gets around the rules of the ACA to be called a ministry. And one of the things we're pushing for is to have health sharing co-ops without it having to be called a ministry and just have it completely secular. And this is important to know that there's alternatives, because I'm going to tell you a dirty little secret of Medicare that a lot of people don't know. It's really quite punitive that if you don't buy the doctor part of Medicare right when you are able to, you get penalized 10% for every month that you don't buy it. You get penalized if you don't buy Medicare Part D, the drug part, every month that until you buy it. And the big McGill is if you don't want Medicare Part A, that's the hospital part, you will not get your Social Security. And,
wow.
And not only do you not get the Social Security in the future after you dropped out, they'll take back what they gave you in the past. I know it's hard to believe, but it's true. There is even a court case about it. People are stunned when they find this out. So there's all sorts of little ins and outs, and the information, interestingly, is there on the Medicare website, but it's kind of you click this, click that, click this, click that. So it's a lot of information you don't get. That's one thing we like to do at AAPS is put all that information in one spot. And we have sections at the website where you can put doctors if you're a doctor, patients if you're a patient, and then you can find anywhere in the United States cash-friendly practices and some of these rules about opting out for Medicare. So it's very useful for both patients and doctors.
So first of all, regarding your website, I can see your aapsonline.org.
Yes.
Okay. Would you describe your organization as both educational and advocacy in terms of lobbying in Washington, D.C.?
Absolutely. Of course, we want to educate physicians and patients because our whole point is to make things better for the patient. That's the key. If they're better for doctors, they're better for the patient, and we want patients to always have choice, to always be able to go to the doctor they want to go to, and be able to find a way to pay for treatments that the doctor thinks is best. Because many times, and I'm sure people have been caught up in this, the drug formularies do not pay for the medicine the doctor actually wants you to get. So sometimes the doctor is forced to get you what's in his or her mind the second best drug. And we don't like that. We like it to be where the doctor gets to do what the doctor wants to do. So part of that, you have to have that individualism. We work in Washington, and in fact, I'm on a kind of a White House list where when they're going to come out with executive orders or any of these new things, where we get the conference call and get some input. And so we always have somebody who attends these meetings, and we just try to get our 2 cents in everywhere. And one of the things we do, and we do this for anyone on our mailing list, and doctors will send out an email, an action alert, like say there's some problem that comes up, there's a bill that comes up that might not be good for the patient. We'll send out an action alert and send out a sample letter that you can just use and write either your congressman or write it to the Federal Register if it's for a rule. And people sometimes think that these things don't matter, but they do matter. In the Federal Register, on several occasions, our name has been mentioned in the ultimate write-up that they give about the rule. They either decided to pass or reject, and they put all of the input that people sent. And there was one rule about health savings accounts that it ended up being almost 70% of all the comments that came in were generated from our action alert, and we can tell and they can track it. And so it does matter, and one of the rules they ended up using was something that we had advocated for. So sometimes it feels Washington is so dysfunctional, and it feels like, is there anything you can do? One of the things we have to say, all you can do is try, because if we stop trying, it will just lead us more and more down a rabbit hole and spend our money and not give us anything for it.
Sure. Your husband was sharing with me that your background is both a physician and an attorney.
Yes.
So you see both sides of the fence. You're able to kind of see it from all perspectives.
Well, pretty much so. I used to do health and insurance law, so I do understand how the insurance works and some of the ins and outs, and it's not pretty.
Totally understand. So in my situation, I'm 61 years old. I won't be eligible for Medicare until 65. First thing that you're telling me is that when I hit 65, I need to get into Medicare right away so that I don't mess up Social Security and so I don't end up paying penalties.
You have to take the Part A. Now, Senator Ted Cruz, he's put it up for 2 sessions in a row at the Senior Freedom Act, which is trying to make it where seniors are not penalized for dropping out of Medicare Part A. It does have a lot of support. There's another group that's a very good group, and it's a lot of it has to do with privacy, and it's Citizens for Healthcare Freedom, and they have sent letters and all sorts of things, really pushing for this legislation, and it will be such a boon to seniors to have this, so they not take Medicare Part A and not be penalized. But it's something you have to look out for.
So, as things stand today, because we don't know what future legislation will be,
that's right.
If I were turning 65 tomorrow, would your counsel be to me, since I have MediShare at the moment, which is the Christian Healthcare Sharing Program, should I maintain that along with Medicare?
And you can, and now they're coming out with newer models, and I'm not 100% familiar. I wish Jeff was here. He's a fellow who works with these sorts of things. And I'm not 100% sure of how their model works, but they do have a model that works with Medicare, and whether it's acting as a supplemental insurance or if the patient, the person wants to completely supplant it, because there are doctors that are completely it's called opting out of Medicare, because they make you have to be in unless you opt out. And I'd say only about 1% of physicians, maybe 2 across the country, are opted out. And you can always see them. You can see an opted out doctor anytime you want, and nothing runs afoul of Medicare. And there's all sorts of little rules about ordering lab tests, but a person can see an opted out physician even if you're on Medicare. But there's certain things, like if the opted out physician orders labs, you might not be able to get them paid by Medicare. So there's all sorts of little rules. But when you go into an opted out physician's office, they have the facts, so you know what your financial responsibility would be, if any. It just depends on what you're signed up for. But the health sharing ministries are getting more and more, and I do know one in particular that has a specific Medicare program.
Supplemental type thing.
Yes.
Excellent. Dr. Marilyn Singleton, I thank you for myself personally, and I know that anybody that is watching this is going to benefit from it. And your website, aapsonline.org, I assume you have a emailing list that people can sign up for?
Yes, absolutely. And if you, on the website, and have to remember to bring my computer down, on the website, that it'll have across the top, join us. And let's see on the, and if you can, that'll be right there, and you can get on the mailing list, and you'll get the alerts, and you'll learn what to do about some of these things that come down the pipeline. Because you don't know if you're not paying attention to this kind of stuff. And we get more alerts from all sorts of health organizations, health affairs, and Fierce Healthcare, all this whole list. It's just tons of newsletters and everything that come into our regulatory affairs department, and they all get read. We see what's going on, and then we tell everybody else what's going on. And people are very pleased, and we just get such a great response from the action alerts, and people really help us out. They kind of say, oh my goodness, the government's going to do this, and then be able to write, and really don't think it doesn't help. And then that's probably one of our biggest mistakes, is when we think what we do doesn't help, but it does.
Gotcha. So there's no fee, or is there a fee for the mailing list?
No fee.
And
no
is there
fee
a
at all.
membership beyond that, or?
Well, you can be. There's all these various levels. Physicians, there's a membership for $350, but patients don't have a membership.
Okay.
That they can just use the resources on the website. What we do have, and it's tax deductible, we have an American Health Legal Fund, and that's what helps us in our lawsuits. Our big pat on the back. We were the people who launched the lawsuit way back when, and we've had tons of lawsuits, but way back when Hillary Clinton started the Hillary Care thing and had a secret group, and nobody knew what was going on, who the people were in the group, and she said she could do it because she wasn't a government employee. Well, we sued and said, you're acting like one, therefore it should be out there in freedom of information, and we won, and then magically the group kind of dissipated.
It walks like a duck and it talks like a duck.
And what do they say? Sunlight is the best disinfectant.
Oh yeah.
And it does
Shed
work.
light on it.
So we do a lot of lawsuits for physicians who haven't had due process, if they've been disciplined in some way without due process, and because this is something that's starting to happen now, and a lot of people may find out, oh, where's my doctor? Well, a hospital system might have bought up the practice, and if there's a doctor who's a holdout and doesn't want to be part of the buyout, sometimes they use kind of funny little ways to try to get rid of the doctor. And we have several cases, and there's one case, it wasn't ours, but this is an example of what goes on. This happened in Houston, and it was a surgeon who used a special robotic technique, and he wasn't part of the big system, and so they really needed to get rid of him. And so they started to say, well, his technique didn't work, he was a bad surgeon, whatever. Well, the whole thing went to court, and the judge said, this is obviously economically motivated. He doesn't have a bad outcome of his patients, and on and on. And the guy got several $1 million as a settlement. So this stuff goes on. And yeah, so I don't care what job you have, what profession it is, there's always an underbelly somewhere. And that's kind of our job. We try to find these underbellies. And because in the end it hurts patients. I can't tell you how many patients write and say, well, my doctor suddenly disappeared, he's not in the group anymore. So we try to track stuff like that down, so we try to help out anybody we can. And because the whole point is that the patient needs to get the best care possible. And it's our job to try to tell you how.
Excellent. I guess your best advice to people as they age is stay healthy.
Absolutely. And the number one thing that is the big numero uno, don't fall. So do everything you can, and you're RV'ers, so you're going up and down those stairs, just pay real close attention, because falling is the number one thing. You go in the hospital, you have something, and people aren't quite the same sense. So don't fall. You'll probably have a long, healthy life. Stay very active, and that's the best thing you can do for your mind and your body.
Excellent. Again, Dr. Marilyn Singleton, thank you for your time, and this organization is absolutely worth your time to check out. Once again, aapsonline.org, and hey, a lot more to come.